So over the last 24 hours, we recorded 6 new cases, and we currently have 386 persons with active COVID across the country. However, this really is an underestimate because the positives that we have over the last 24 hours, for example, depending on how many people came forward to be tested. So people are having signs and symptoms of COVID because they're not testing. And even when some of them do self-testing, they're not reporting it. So we don't have a very accurate picture of how many persons might have tested positive. So right now we have 15 persons in hospital, 13 at the Ocean View Hospital, and 2 persons in the ICU. With the Ministry of Education, we have been working with them to see which schools might be ready. So the ministry has been sending out letters when school is in session, sending out letters to the parents to say that we are going to be doing a vaccination drive, and the parents would have to send back a consent form authorizing that their child would take the vaccine. Once the Ministry of Education receive back those letters, then they would coordinate with us, and we'll send a team to that particular school to be able to do these vaccination drives. So that's something that is going to continue when children return from school. Persons who have been vaccinated would get a less severe form of the disease if infected. So it makes good sense to be vaccinated, to be prepared so that your immune system can respond appropriately and you wouldn't have further complications. So long COVID is something that we notice 3 months after someone would have been infected with SARS-CoV-2 virus, that they have prolonged symptoms. And some people might have manifestations where they're having constant headaches or hallucination, delirium, and all kinds of problems. Others might have manifestations of it with heart problems. So 6 months after you start having chest pains, and when they do the examination, they find that you can have cardiac problems. In some people who never had diabetes, they're now showing up with diabetes. So the symptoms for long COVID varies widely, covers a range of disease entity, can affect multiple organs, and therefore, if we want to prevent it, one sure way of reducing this burden is for people to be vaccinated. Right now, for adults, we have 445,755 doses that were administered. That's the first dose. That takes us up now to about 86.9% of our adult population receiving a first dose vaccine. Second dose, we are now at 345,481 doses. That's 67.3%. Now, if you've had a vaccine 1 year ago and you didn't come back to get a booster, then it's not going to be very helpful. So you have to be boosted at least every 6 months. The experts are recommending even a shorter time, at least every 4 months. In terms of ages 12 to 17, we've had 35,542 persons receiving their first dose. That's 48.7% of that adult population. And for second dose, we have administered 26,049 doses, or 35.7% of the population. Children 5 to 11, So far, we have been able to give 7,681 doses. That's 7.5% of that age cohort. And second dose now is at 2,818 doses, or 2.8% of the age cohort. Currently, with boosters, we now have 72,144 booster doses that have been administered. But again, because most people would have received their first and second dose maybe about a year ago, there's really need for them to take their boosters now.